بسم الله الرحمن الرحيم. موضوع المحاضرة هو البلازما اكسشينج in COVID-19 patients. أنا اسمي أشرف عباس المراغي، أستاذ مساعد الأمراض الصدرية بطب عين شمس. أهلا وسهلا بكم. As we all know that the novel coronavirus or the COVID-19 disease is a highly contagious acute respiratory infectious disease. It was first discovered in December 2019 in South China seafood market, Hubei province in China. It is a highly transmissible disease. The number of patients, as we all know, crossed the number of 9 million and is rising every day with increased number of deaths around the world, and the infected people are not restricted by race or borders. As we all know, the common symptoms of COVID-19 include the fever up to 38 or above. Also, there is dry cough, fatigue, sore throat, dyspnea, and frost glass-like symptoms in the lung. As we all know, that there are several medications and treatment protocols are used nowadays in different countries to deal with COVID-19 disease. But one of the most important issues about the treatment is the immune response of the patients towards the coronavirus. As we all know that when the immune system of a patient is exposed to a foreign organism or substance like the coronavirus, the immune system will respond by forming immunoglobulins specific against this foreign substance or organism. The plasma rich in immunoglobulins against coronavirus will be called the convalescent plasma. On March 24th, the Food and Drug Administration announced an investigational treatment for the new coronavirus by removing the blood plasma from a patient and replacing it with a convalescent plasma from another patient who has recovered from the COVID-19, which may help fighting the infection. This process is known as the plasma exchange, or PE. The convalescent plasma can be collected like a blood donation, and techniques are performed to assure the plasma is free of any infection. It is currently recommended that someone be symptom-free for at least 2 weeks before donating plasma, which is the convalescent plasma. Although plasma exchange is a promising modality in treating COVID-19 disease, yet there are some contraindications for this technique. For example, patients who are unable to have a central line placed because the plasma exchange needs a wide bore line. Also, any patient with known allergy to human albumin or fresh frozen plasma will be unable to receive plasma exchange. Any patients with hemodynamic instability or active infection or sepsis, it will be contraindicated to perform plasma exchange, as well as the people with hypocalcemia, because the plasma exchange itself can induce hypocalcemia due to the citrate which is used to prevent the clotting of blood inside the machine. Plasma exchange is not a new modality in treating COVID-19. I mean, it is a well-known modality and standardized and safe therapeutic procedure used in the treatment of various diseases that require the rapid and prolonged elimination of endogenous and exogenous substances with deleterious effects on the function of different organs and systems. For example, the efficacy and safety of plasma exchange has been demonstrated in patients with fulminant hepatitis, which is characterized by an exacerbated inflammatory response, multiple organ failure, and high short-term mortality. In fulminant hepatitis, the plasma exchange improved the systemic inflammation, prevents the organ failure and renal support requirements, and improves survival. Such treatment eliminates important endogenous and exogenous inducers of the systemic inflammatory response, the pro-inflammatory mediators like cytokines and other biologically active substances like nitric oxide, prostaglandins, and bradykinin that are involved in the pathogenesis of organ failure. In addition to fulminant hepatitis, there are several case reports that suggest that the plasma exchange is an effective rescue therapy in critically ill patients with swine flu. However, the efficiency and efficacy of plasma exchange has not been evaluated in critically ill patients with COVID-19 disease yet. So it will be a future research about the role of plasma exchange in treating severely ill and critically ill COVID-19 patients. How to proceed for plasma exchange? The plasma exchange involves separating and removing the plasma from the blood of the patient. And this is done by a plasma exchange machine, which is called the Optia. The red cells, white cells, and the platelets are returned to the patient along with a prescribed replacement fluid, which may be what is called the octaplas, or which is a solvent detergent treated plasma, or the convalescent plasma, or human albumin, or even both. The length of the procedure varies from a patient to another depending on the total volume and type of replacement fluid used, but it usually takes between 2 to 4 hours. During the procedure, the vital signs, including the temperature, the blood pressure, pulse, and oxygen saturation, will be checked before, during, and after the exchange, and any changes will be recorded. During the procedure, the patient will be closely monitored for any side effects. The Optia machine will automatically take the blood, spin it, collect the plasma into a bag, and return fresh convalescent plasma or human albumin or both along with blood cells to the patient. The exchange can be done between 1.2 and 1.5 plasma volumes that will vary according to the sex, weight, height, and hematocrit level. Polyclonal immunoglobulins can be administered at a dose of 100 mg per kg after each plasma exchange in addition to optimize the response. When we come to the side effects of the plasma exchange, it may include hypotension, which can cause dizziness, blurred vision, feeling cold, and headaches. Also, there may be mild allergic reactions in the form of chills, fever, flushing, rash, dyspnea, or loin pain. Also, there may be numbness around the mouth or in the arms due to hypocalcemia caused by the citrate used to prevent clotting in the machine, as we said before. Also, there may be muscle cramping, bruising or swelling, fatigue, and the serious complications of plasma exchange is anaphylaxis, which is usually caused by a severe allergic reaction to the plasma replacement fluid. This is one of the reasons why plasma exchange is done within a monitored setting. Potential risks for the plasma exchange may include infection due to the placement of wide bore lines in the vessels. So the technology used nowadays and the sterile replacement fluids may limit this incidence of infection. Also, clotting of the blood inside the machine is prevented by the use of anticoagulants before and during the procedures. There are a number of potential risks that are accompanying the plasma exchange. They may include bleeding due to the anticoagulants used, arrhythmias due to hypocalcemia, shortness of breath, abdominal cramps, seizures, and very rare death. Death may represent 0.03 to 0.05% of all cases. The majority of deaths result from the respiratory or cardiac complications. At the end of the lecture, you will notice that the plasma exchange use in COVID-19 disease is still under research, and still ongoing clinical trials are evaluating the procedure and its benefit in COVID-19. You will notice that the plasma exchange may represent a tool that reduces the need for mechanical ventilation in severely ill patients with COVID-19, or even the patients on mechanical ventilation, it may reduce the length of stay on the mechanical ventilation, and eventually it may help in reducing the mortality due to COVID-19. I hope you furtherly read about the clinical trials ongoing about the plasma exchange in COVID-19, and I hope you are well, and may Allah keep you safe, and assalamu alaikum wa rahmatullahi wa barakatuh, and thank you very much.